Hey guys, welcome to another episode of ViTAC University. We're going to go over how to use the splint. So if you have an ankle, if you have another injury, we're going to go over the ankle first, okay? So I'm going to go ahead and I'm going to grab my ViTAC kit. I got my home kit here. I'm going to go ahead and I'm going to grab my splint. So it'll have some spots on here. You should just be able to rip it off. I like to leave mine wrapped just to keep it clean, but some people like to just open it up and leave it open so that way it's easier access in an emergency like this. But all you're going to be using this for is to stabilize that wound for a little longer, just for transport to the hospital or wherever you're going. If you're out on an adventure and you need to stabilize this to actually get them to walk themselves out, you can use this along with some sticks to stabilize and stuff like that. Make some kind of improvised crutches on the way out too. So this is a 24-inch flat splint. You're just going to open it up and you're going to flatten it out to however much you need, okay? So if you need it like all the way open, you can do that. You can do it in halves. Whatever is the size you need, just bend it to however you need this, okay? So if this is her ankle, I'm going to go ahead and I'm going to take this off, okay? And I'm just going to figure this out kind of how much I need to go up. I'm going to use this whole thing to help stabilize. The other thing I can do is flatten it out using the ground, using this. And then you can actually even create a little bit of a crease all the way down, which will help kind of keep it stiffer. All right. So after that, I'm going to go ahead and I'm going to get it up under the foot, and I'm going to wrap this up and around the ankle just to help stabilize this. It doesn't have to look pretty when you're putting it on. Now, the question is, how do you want to secure it? Really, you can secure it any way you want. You can use tape. You can use anything you want. I'm going to go ahead and use the Ace wrap that we have in here. Rip that off, open it up, and this will help provide even a little bit more stability, right? Watch your clips. Okay, so I'm just going to tuck this down and under, get a decent wrap. Try to get it to hold the patient's wound a little bit, and then get it up underneath so that way you are truly wrapping this thing around that wound. To help stabilize that joint just for transport, okay? And then you can grab your clips again, right? Clip them right back in. Find a good point to have it bite onto. All right. There's just some little teeth, and all you do is get it to bite onto. You're not too worried about it sitting here, but you want to position this around there. Now, this is my wife's leg, so it looks like it's pretty stable. I move this around, check and see. You want to make sure you're still getting circulation down into the toes, into the heel, things like that. That may also be impacted by whatever is going on, whether it's a sprain or break that you're trying to stabilize. If it's a break, depending on how it goes, you may have to loosen things up just to make sure blood is flowing, all right? But just check and see if everything's moving around, make sure they still have feeling and stuff like that. And this can be a painful process, of course, so just make sure if it is one of your kids or something like that, know that it's going to be hurting them and it's not fun to deal with and listen to as a parent, watching your kid in pain. But as long as this is nice and stable, this works very well. You can, of course, just use athletic tape as well to secure it, or even in our home kits, we got Cobain, so you can use that, or Coban. You can use that. So again, thanks for checking out ViTAC University. If you guys need anything else, reach out to us, all right? Thanks.